Namaste. Me, Dr. Amita Phadnis. I'm the director of Oyster and Pearl Hospitals, and as all of you know, I'm a pediatrician neonatologist. Some weeks back, we started this series called Aarogya Katta. So this is one more addition to that series, and today we have a renowned orthopedic surgeon, Dr. Ashish Arbat, who's here to share some thoughts on operation theatres and what he values the most in the operation theatre. At Oyster and Pearl Hospital, we have a huge operation theatre complex, and the operation theatres are actually the heart of the hospital, and sadly, mostly the patients don't know about it. So, Dr. Ashish, hi, thank you for joining us. And would you be able to tell us that as a surgeon, what do you most appreciate about the operation theatres at ONP Hospitals?
And madam, nice preview and nice idea to start this Arogyakatta.
Yes.
Because आपण जेव्हा कुठल्या गोष्टींचे डिटेल्स मध्ये जातो, we go in details of things. We understand why modern hospitals or the success rate of a surgeon, it depends on lot of things. It's like a movie. It's like a movie. So you need a good director, you need a good production house.
Absolutely.
And orthopedics, ophthal or any bigger surgeries like cardiac, they need very good operation theatres. Just making good operation theatres is not the answer. The inventory, the paraphernalia that is needed along with it, you know, it's like the CSST department, the entry of the OT complex, the lining of the OT complex, laminar flows. And I have been working since last near about 15 years, right from England, US. I've been in one of the best corporates, but I have seen one of the best OT complexes, not just she is around, but as a surgeon, OT complex, one of the best in Pune, especially the Oyster and Pearl Hospital of Shivaji Nagar. And I'm really overwhelmed, ma'am, because the ease that we can do work here. We have everything, and everything is two. Like the picture में joke म्हणतात ना, सब कुछ का दो लेके आ भाई. So you ask for one, you get two. We have 3-4 C-arms, we have 5 OTs, very well maintained operation theatre complex. Even the instruments are refurbished very well at times. And as a surgeon, there are two things that we worry. One is the infection. Second is availability of resources. We are as good as our instruments. We are as good as our our staff around us. We have very well trained staff, and that makes our life very easy.
Absolutely.
Madam, we have done massively complex cases here, and our anesthetist team is so good. And since the owners are doctors, you know, they know the needs of a doctor. See, having a good ambience in the hospital.
So here I am going to interrupt Dr. Arbat and say, Dr. Avinash Phadnis, who is a gynecologist, he is the heart and soul behind the operation theatres. So he would not compromise on that at all. And like I've mentioned many a times before, we have a 60 years legacy in healthcare, and truly at heart, we are thorough professionals, and for us what is most important is to give the best in healthcare.
Yeah, and like madam, what she said is, see, the Oyster and Pearl operation theatres can be compared to the operation theatres in the US. They have far gone beyond what is the Indian scenario of operation theatre in India is, because we really feel that we have come back to the US, right from the door mats, the sticky door mats, to having the corridors fumigated, and huge complex. It is the mammoth complex that we have, and that makes a whole of a difference. We have phenomenal waiting rooms for the patient. We have ICU, HDU separated, and that makes, madam, our life very easy, because most of our surgeries are very high demand.
Yes.
And
I'm sure,
thank you for that.
And I'm sure a good operation theatre contributes in a big way to the success of the surgery. Am I correct, doctor?
Definitely.
Yes.
Success of the surgery doesn't, what happens is, we have big hospitals in and around, there are big brands, but what happens is, they being new, the staffs are new, they are not being, cherished by
the organization.
Because organization is new, and a lot of infections, a lot of small things happen which are detrimental for the surgeon and the surgical team. and we are the newest entrants of the ONP group, and we are lucky that the experience that these people have put in, we are taking the benefits and reaping the fruits now, I guess.
So we are most delighted that people like you, talented surgeons like you, come to ONP, because it's always, you need the entire circle to be completed. It's not enough to just have a good operation theatre and the equipment and the CSSD. I think a good surgeon complements, the operation theatre and the surgeon complement each other.
I would compare this to, say, orchestra, where I might
Yes,
be the Arijit Singh
absolutely.
today,
Yes.
and these guys have become, have the legacy,
Yes.
like Preetham. They have been working with Lata Bai, they are working with
Yes, yes.
Kumar Gandharva, and we are just benefiting or getting.
So I think
the
what I
benefit
would
of it.
say, the experience counts.
Yes.
Experience in doing these things counts. So thank you, Dr. Arbat, for that wonderful compliments about our operation theatres, and we truly believe completely that operation theatres are the heart of the hospitals, and any of you are welcome to come and see our operation theatres anytime. Thank you so much.